It's time for good energy, and I'm Dr. Julie, and welcome to Bodyful Day 166. It is day 6 of acid reflux and the senses, and today we're talking about the kinesthetic sense. And this is one that I'm really always excited to teach and talk about when it comes to acid reflux, because it is a way for you to do self-healing with chronic acid reflux. So before we get to that, let's start with the basics. Go ahead and take a deep breath in and release. Go ahead and take another deep breath in. Expand in the stomach, expand in the chest, expand in the sinuses. And if all of that is expanding right, you should kind of feel your tailbone tip back. So go ahead and take a deep breath in. And release. And now think about anything going on today, any stressors, any good energy in too. And breathe into that. Take a deep breath in. And release. Okay, so today we're talking about the kinesthetic sense. Remember, the kinesthetic sense is where your joints and muscles are in space. Well, no, where they are compared to the rest of your body, how you move them, how your muscles and joints move, whether or not they're moving in the right way, if they've moved too far. The cool thing about the kinesthetic sense is it can give us an indication of what's going on in our diaphragm, because the diaphragm is a muscle, and it can also give us an indication of what's going on in our stomach, because our stomach is also a muscle. So diaphragm wraps around the esophagus, which then goes in and makes the stomach. And from the kinesthetic sense, we can talk about, well, how does our positioning affect our acid reflux? So one of the things we know is that if you sit like this a lot, that if your stomach is full, it is going to push up, above that diaphragm. I'm going to use the diaphragm this way. Well, no, I'm going to use it. I'll use the diaphragm. It can push up above that diaphragm. And once it pushes up above that diaphragm, you're going to have acid reflux. Now, you slouching in a driver's seat, or in a passenger seat, or in a car, or in an airplane, is not, just sitting there once is not going to cause that problem. But sitting in there driving multiple times and doing multiple distances is going to cause that stomach to herniate up. And a sliding hiatal hernia is one way to have chronic recurring acid reflux, because once that, so if this is the esophagus and this is the top of your stomach, once that goes up above, you're going to have acid producing glands that are up above your diaphragm, and when they do that, they are going to produce acid in a way that's going to come up as acid reflux. Now, there is another very common way for that to happen. You don't have to be sitting in a slouched position or tucked into a chair. It can happen with babies. So, baby number 1 for me had a very big butt that he liked to set right underneath my stomach. And when he did that, he would push my stomach, he would herniate my stomach up above my diaphragm, and I would get acid reflux. And so there were many a night that I would be, even if there was a butt there, trying to pull that stomach down. So the other part of the kinesiology component is that we can learn something called the stomach pull down. Very easy, very simple. They actually do it with babies who have acid reflux. You can find their stomach and just kind of tug a little bit, or rub a little bit downward towards the belly button of the stomach. You can do that with adults too. So if you have chronic reflux, you can go along your rib cage, the bottom of your rib cage, till you find a tender point. So I'm pretty good now compared to what I was on Tuesday. But find a tender point, use your big fingers and put it on that spot, and take a deep breath in and blow it out, and just kind of gently tug towards your belly button. Always do it on the exhale, because on the inhale your diaphragm descends, On the exhale, your diaphragm comes back up, and so you're kind of doing a suction thing where the diaphragm is coming up, you are pulling down, you're kind of going for. And in fact, when I learned this in chiropractic school, it was a separate class with somebody who was coming in from outside campus at a separate seminar. When he did it a couple of times, you could actually sort of hear as that stomach came unstuck from the diaphragm, as that esophagus and fundus went back down below the diaphragm where they were supposed to. And so you can do that. You're not going to feel a pop as much, but you're just, before you go ahead and eat a meal, or after you've been sitting in a squished position for a long period of time, if you've been riding in a car for a long period of time or on a long flight, when you get off that flight, you can do this lying down, you can do this standing, you can do it seated. I will tell you, it probably has its most effect when you're lying down because you can kind of get in there and kind of push it down a little bit. Remember, don't be harsh to yourself. Nice, easy kind of pull down towards the belly button is enough to kind of pull that stomach out from where it is. And you can just do that every time you eat until you notice that, hey, I'm not getting acid reflux anymore, because that feeling, that kinesthetic sense is telling you that the diaphragm is feeling better. And if we go back to touch, those ribs should feel better, and that sternum should feel better when that stomach has been pulled down. All right, so that's it for today. Just talking about the kinesthetic sense and how to pull your stomach down if you have chronic acid reflux. Now, that won't work for everybody. That I should say, that's a caveat. This won't work for everybody, and you might want to talk to your doctor before you do it. But it is just a self-massage technique, and it may help some people who spend kinesthetically a long period of time in the wrong position. And so if you are always upright and moving around, there's probably less likelihood that you have squished that stomach up above the diaphragm and need less work there. So just looking for alternatives, ways to kind of make sure that the stomach is in the right place so that it can do what it's supposed to do. You might ask, well, wouldn't you be able to find that on a scan or on an ultrasound? It's possible. It's possible if it is up there and it is stuck. But a lot of times there's a diagnosis called the sliding hiatal hernia, which is a hernia that just kind of slides up and down depending on your positioning. So sitting down to eat in front of the television when you're squished on the couch is going to push it up. And if you eat while you're there, you're going to be producing acid that's going to come up into your throat. So you're going to get your acid reflux. So those are things to pay attention to. All right. Well, tomorrow we're going to come back and we're going to finish this off with a sense of smell. And I kind of got ahead of myself because I was going to talk about silent reflux tomorrow, and I already did. But we'll see what I can come up with tomorrow anyway. All right. Have a great day. Let's finish it off. Take a deep breath in. And release. All right. I'll see you here tomorrow.